It is so common for me to have conversations with women about the kind of sexual pain that they're having, and they really don't even have the words to describe it. And interestingly, healthcare providers don't either. So let's break down some of the different kinds of sexual pain that there are so that we can put them in categories and really start to understand what's going on. First, we've got psychological versus physical. And what I find is that almost every client I've ever spoken with was told at some point along the way that she had a psychological problem. She needed to learn to relax, go to some counseling, drink some wine. And in my experience doing this almost 13 years at this point, I have found that never to be the case. What I have found is that women will either come to me exclusively talking about a history of trauma or some mental health aspect of this, and in that case, yes, that is what's going on for her. All of the other women that I speak with say, this doesn't feel right to me. I don't think it's a mental health issue. I feel actual physical pain, and I'm very interested in my partner. I would like to have sex with my partner, but it physically is painful. And in 100% of those cases, we find a physical problem. So if your gut is telling you that this is not a mental health problem, I agree with you. It's not. And so hopefully that kind of helps to start just separating those two. Now, there are lots and lots of resources out there for women with mental health issues around sex, and I'm just going to leave that to the side because I work with women who have physical problems. And now we have to break that down into two different categories. One is the superficial, and the other is deep. Now, deep dyspareunia, and dyspareunia is the medical term for difficult or painful intercourse. Deep dyspareunia is when the penis is all the way inside of the body and the tip of the penis is hitting into the cervix, and that is jostling the pelvic organs, the uterus, maybe the bladder, the ovaries, could be some part of the bowel, and that jostling is causing pain. Now, that is something that an OBGYN should be able to discover, and if they need to refer you elsewhere, they should be able to do that. That is something very well managed in mainstream medicine. That said, you definitely do want to have that worked up by your healthcare provider to make sure that there isn't something more concerning going on. And as long as there isn't something more concerning going on, we can work around that pain with different techniques and strategies. Now, the other kind of pain that we can have is called superficial, and that is right at the opening to the vagina, maybe on the exterior surface of the body or just inside. And that is much more difficult to get help for. While your OBGYN should be able to handle anything that's going on deep, most women who experience pain that is superficial have a very, very difficult time getting any help for that, if ever. So if that's the kind of pain that you deal with, that's what I'm going to be talking about here on this channel, and in my masterclass, and in my program. So you have found the right place. Welcome.